Hi, it's Renee, staff PT at the Kirk Center, and today I want to go over male pelvic anatomy. So I've got a male pelvis model here. So here's a male pelvis. Let me show you a female pelvis model. All right, they don't look too different. With the external genitalia removed, the male and the female pelvis look a lot the same. So I'm going to be going back and forth between these two. This pelvis shows a little bit better anatomy on the back side, so I'm going to be using this a little bit later. But let's use the male model first. So let's start with bones. Here's the bones of the pelvis. Ilium, pubis, pubic symphysis here. This circle is the acetabulum. That's where the hip bone, the ball and socket joint of the hip, sits right in here. If we look at the back side, let's switch to the female next. So back side of a pelvis, male or female. We've got the ilium bones. We talked about that. These bones here on the sides, people call these the sitting bone or the sits bones. This is the ischial tuberosity. Here in the middle, we have the sacrum, and at the end of the sacrum, we have the coccyx or the tailbone. This up here is like the last lumbar vertebrae, so like L5 for most people. Okay, so back to the male pelvic model. Things you might notice between a male and female pelvis model would be the pelvic cavity is a little different. So the bones are the same, but they're shaped a little different. That is so if a woman can carry and deliver a baby. Okay. Male pelvic cavity contains the pelvic organs. So you can see here a little bit, we've got a rectum. That's where stool leaves the body. Bladder that holds urine. The top of this bladder has been removed so we can see inside. And then below the bladder we have the prostate. I'm going to try to show you that. Okay, here's the bladder. This little pink guy here below the bladder is the prostate. And this tube is the urethra. So the urethra passes through the prostate to leave the body through the penis. Okay. So let me get the bladder back in the pelvis. Okay, so let's just take a peek at the male anatomy drawing here. So one thing I want you to notice is that it's pretty close quarters, and nothing is just floating in there. It's not just a nice big open cavity with lots of space. Everything is connected to each other. There's also arteries, veins, nerves, everything is running through the same space. So it's important that everything has the space it needs to do the job that it needs to do. Okay, so we covered bones, we covered organs, and so let's talk about these pink tissues here. So this is not the best representation, but the pink represents pelvic floor muscles. So men and women have pelvic floor muscles. So let's use a diagram instead of the model for this one. So we've got 3 layers of pelvic floor muscles. Men and women have 3 layers. This drawing represents probably, we'll call it layers 1 and 2. So it's kind of this triangle here. And then this muscle runs up the center here, the length of the penis. And then the sphincters would be also at the tip of the penis here. The sphincters are also part of these superficial muscles. And then we have deep pelvic floor muscles. So this would be deeper than everything else. You can see that a male pelvis has 2 openings, one for the rectum, one for the urethra. And you can see how this group of muscles covers the entire pelvis from pubic bone to coccyx, from ischial tuberosity to ischial tuberosity. This group of muscles is called the Levator Ani group. And it actually has its own syndrome named after it. So there's a syndrome called Levator Ani syndrome, which is basically pelvic floor muscle dysfunction. And it's when one or more of these muscles becomes dysfunctional, possibly in a spasm or with trigger points. And again, this looks so nice and clean and clear cut. Remember, fascia is connecting all of these tissues. These layers of muscles work together. They're connected to each other. So that's important. So what do pelvic floor muscles do for men? They do the same thing that they do for women. So pelvic floor muscles have a support role. So the pelvic floor muscles support the pelvic organs. Men can have pelvic organ prolapse the same way women can through the rectum. So men can have rectal prolapse. The pelvic floor muscles also provide stability. So they stabilize the pelvic bones. The pelvic floor muscles work with our core muscles. So if you've ever done core work, you've also done pelvic floor work. These muscles also have a sump pump quality. So when someone is aroused, a lot of blood flow rushes to the pelvis. Also, if you think about the pelvis, we have a lot of lymphatic vessels and lymph nodes in the groin. So when these muscles contract and relax, they help pump blood flow and lymphatic fluid out of the pelvis and back up into the bloodstream. They have a sexual function. So when we have an orgasm, women or men, the pelvic floor muscles contract and relax rapidly, and it provides a stronger orgasm if the muscles are stronger and function better. Some people think stronger muscles is better, but remember, muscles need to be able to contract and relax. So if your muscles are always tense, it's not great for sexual function or any other role of the pelvic floor muscles. So pelvic floor muscles that are healthy contract and relax. Speaking of relaxing pelvic floor muscles, we also have sphincters. So these muscles have a sphincteric role. We have urinary sphincters, internal and external, male and female, and then we have an anal sphincter at the rectum. These sphincter muscles have to relax in order to let us empty the bladder and empty the bowel. So that's male pelvic anatomy, bones, muscles, organs.